Welcome, everyone. This is Krista Nash. Thanks for joining me for today's podcast. I'm honored today to have with us forensic and clinical psychologist, Dr. Richard Spiegle, with whom I have the great pleasure of working on cases here in Colorado. He brings a wealth of experience. So welcome. We're so glad you're here.
Thank you. I'm so glad to be here. This is my first podcast.
Wow, really? Well,
Yes.
welcome. Welcome to that too.
Thanks.
You're going to be a natural, I know. Just an easy conversation about what we can do to make family law better for kids from your seat. So tell us first how you got into this line of work and what was your education and how did you get interested in this?
Well, in undergraduate school, I got exposed to special education and got placements in institutions working with severely retarded and mentally ill children and with their families. So that was my introduction. And when I graduated from undergraduate school, I taught special education and moved on to an administrative position with special ed and decided that I wanted to get back to working with individuals. So I went back to graduate school and got my doctorate in clinical psychology and studied forensic psychology. So the way I got interested I was always working with families, even in undergraduate school. But about 25 years ago, at least, I was getting dressed in the morning and listening to NPR, and I heard a segment on what was called early parent loss syndrome. And they discussed the research, and I became intrigued with that. So I started studying the research, reviewing all the literature, and early parent loss syndrome is a group of characteristics that children who have lost a parent, young children, even at birth, infancy, adolescence, when they have lost a parent, they become afflicted with all kinds of symptoms and characteristics and problems, emotional problems, depression, difficulty with relationships, academic problems, susceptibility to drug and alcohol problems, and even economic problems. Even if children are adopted or have a step parent, that's the most wonderful. You can't replace the biological loss because it's an inherent need that we have to attach to that. So I became interested and started doing family therapy, and I was received referrals for what was called family therapy, supervised parenting time, reintegration therapy. It's been called a lot of different things. I've learned over the years, especially when I read the research on early parent loss, how important it is to see what you could do to fix a broken relationship between a parent and a child. Sometimes it's not possible. It's often very challenging because typically there is a favored parent and a disfavored parent. And the favored parent, more often than not, is upset with the other parent, the disfavored parent, and is not in favor of the child forming or fixing a relationship with that disfavored parent. If the favored parent is not 100% in favor of it and supportive of it, the success rate becomes very low.
So let's talk a little about these dynamics when you've got so many. I know we can't really generalize because every case is a little bit different, but what do you see as much as you're able to synopsize what you're seeing, especially is what age is this starting? Is the age getting younger for this resist refuse dynamic that occurs? I think we started calling it really parent contact problems as opposed to reunification, because that's been a very overused and polarized term. And it's not a term that the Colorado statutes really even support anymore. I think Dr. McNamara, who's also been a guest on the podcast, has really emphasized this child parent or parent child contact problems as a way of explaining it. What kind of cases are you seeing come in? Have those changed over the years?
I just got a call the other day about a 3.5-year-old who has not had contact with their father for a year, and the child doesn't remember the father. So it's me kind of introducing and facilitating contact and a relationship. So you ask at what age? At 3.5 is the youngest that I've done
Oh,
it
wow.
with, or I've probably done it over the years with younger children. There's also some similarity between reunification therapy and supervised parent contact, where I've been ordered by the court to supervise the contact between a child and their parent. because they can only see the child in that setting. So that's kind of like reintegration therapy. And I, on the other end of the spectrum, um, I have a couple cases, and about one. The child's almost 18 years old, um, and does not want to have contact with one of the parents. So it ranges from 2 years old to 17 and 3/4 years old.
So has it been changing over time? I guess my perception is that, and I don't know if this is, I don't know if I have enough years experience to know if this is really accurate or not, is is the idea that kids that are younger and younger, I mean, the 3.5-year-old might be an outlier, but for example, I have one who is like 12, or we have like an 8-year-old, who's refusing contact, as opposed to what I think we normally view it as is um, is the teenagers, like more like 15, 14, those kind of ages. Have you seen a change?
No, I have not noticed a change. It depends on the circumstances. When abuse is a factor, it could be with a child as young as 3, 5, 7, 9, um, and uh, up to 17. So I haven't seen any difference or change in the age of those kinds of referrals. When there's a disruption and a fracture in the relationship for whatever reason, then that would be an opportunity for family therapy or reintegration therapy.
So, talk about that from a mental health perspective. If a kid or even to a parent maybe who is just shutting the door and saying it is so much better if my child doesn't have to have any contact with this person anymore and never has to see them. How do you try to get through to that favored parent or that child who just absolutely wants nothing to do with it? How do they understand that that's bad? Maybe it's about the early childhood loss
That's one of the aspects that
process.
I'll talk to the favorite parent about. Another is uh, I want the child, even adolescent, to be desensitized and not run into that parent at Safeway and go through a panic attack. I want them to have contact and express themselves in a safe environment and understand what the rules and procedures and guidelines are so that uh, they feel more confident, more confident is really the best word. Empowered is the word I was looking for. That they could speak their mind and speak to that parent and protect themselves. So those are the two main aspects: early parent loss, which I'll even explain to the child and or adolescent that at some point, if you don't work on this now when you have the opportunity, you might regret it because that parent will always be your biological parent, and uh, now you have the opportunity to work on fixing it with my help. Um, and the other is desensitizing because they'll walk around with, even if the child has been terribly abused, they might walk around terrified that they might run into them. And the process can desensitize them while still protecting them completely.
Talk a little though about how careful you are because there's some therapists. I mean, you're among the very elite and small group of therapists I trust with these kids because I go to them and say, I know you've had failed therapy before. I know that you've been triangulated, in therapy with a parent where the therapist threw you into a room with your disfavored parent and, you felt like you just got attacked all over again. I'd say almost all of my complex cases have had that happen where a kid is willing to go to therapy and then they've gotten burned somehow. So how do you approach this differently or how do you recommend mental health professionals do this in these kind of cases so that it is more careful and successful?
I make it clear to the child and to the disfavored parent before we have joint sessions that there, there are a couple critical requirements that the disfavored parent must adhere to. One is if the child tells you anything that you did that he or she didn't like, that upset them, that were awful, dreadful, even if they're making it up, fabricating it, the parent has to listen, not interrupt, acknowledge the feelings, not the content, and validate the feelings. That's very hard for a lot of parents to do because if the child is going to fabricate something that the parent never did, the natural reaction is to defend oneself. But this structure is you listen, acknowledge the feelings, validate the feelings, don't interrupt. Uh, um, that allows the child to express and sit back. You heard me. You understand what I'm saying. You accept what I'm saying. That's the number one first step that has to occur. The child has to express. The disfavored parent has to listen, acknowledge, and validate. And then we could go to the next step and look for solutions.